So Rare Disease Week is really one of the major events that we have each year. The EveryLife Foundation works to empower patients and patient advocates and give them the tools to actually lobby Washington, D.C., meeting with their members of Congress and the administration, FDA, NIH, all the agencies that are relevant to what we're doing. Rare Disease Week is really the time when advocates come from all over the country and learn how best to navigate that bureaucracy, what are the tools that they might need, how to have an effective meeting, and we try to empower them through the first few days of Rare Disease Week, and then they all go to the Hill with us for meetings with members of the House and Senate, their members of Congress from neighboring states and districts. We try to make it a full, impactful day so that members of Congress can hear from them. Sure. So we've been growing every year. I recently joined the EveryLife Foundation 3 months ago, but I've seen Rare Disease Week as a former congressional staffer, and I met with the RDLA advocates each year, and I was able to see how every year more advocates were coming into the meetings with myself and the congressman that I worked for. So it's great that each year we're growing, and this is the most people we've brought down yet to Washington, D.C., which has been very helpful to the ultimate goal, because when you bring in more people, you're able to touch more members of Congress and actually have a greater reach to those that might be on certain committees that you hadn't been able to meet with before, and that's why it's become more and more effective as it's grown. So our three main legislative asks are: one, reauthorizing the Newborn Screening Saves Lives Act. This is a 5-year reauthorization that expires at the end of this year, so that's really a top priority of the foundation and of the RDLA program. Another is increased funding for FDA and NIH. NIH provides a lot of that basic research in healthcare, and then the FDA, when it has the resources to support it, is able to move treatments and cures through the pipeline process more quickly, ultimately getting it to patients faster. And the third ask is going to be joining the Rare Disease Congressional Caucus. The more members of Congress that we can get who are joining that caucus, the more reach that our organization is going to have when we're actually promoting policy goals throughout the year beyond just Rare Disease Week. I think it's important to remember, I spent 3 years meeting with RDLA as a congressional staffer, and I saw firsthand how I walked into the first meeting 3 years ago. I knew nothing about rare diseases. It wasn't something that was a priority of our office or the member that I worked for, because we just hadn't been educated on it. And after a short meeting people from our community who had been affected by rare diseases, it became a top priority of our office and a topic that was constantly discussed, whether it was looking at legislation or just writing statements. Rare diseases came up. And so I think most people might not realize how in just a short 10 to 15 minute meeting with their member of Congress or a staff person in that office, you can have a huge impact that will last years, because that member of Congress is going to care about rare diseases. They're going to talk to the people they work with at the NIH, at the FDA, other members of Congress, and it's really going to have a ripple effect that is going to help a lot of policy priorities that will be helpful to the rare disease community.